Hello guys, in this video we are going to see about prednisolone. We'll see the classification, mechanism of action, indications, side effect and doses. As we already know, prednisolone is a glucocorticoid and it has two important actions, anti-inflammatory and immunosuppressant. Let us first see the classification of corticosteroids. Corticosteroids can be divided into glucocorticoids and mineralocorticoids. And in glucocorticoids there are three groups, short-acting, intermediate-acting and long-acting. The prednisolone falls in the intermediate-acting group. The short-acting is hydrocortisone and long-acting is dexamethasone and betamethasone. Now, this is a very important and famous table, that is conversion rate of these glucocorticoids. As we can see, 0.75 mg of dexamethasone is equal to 4 mg of methylprednisolone is equal to 5 mg of prednisone is equal to 5 mg of prednisolone and is equal to 25 mg of hydrocortisone. And this is a must know table and you should always remember this. Now, let us see the important actions of prednisolone in our body. It increases gluconeogenesis, it decreases glucose uptake, it increases lipolysis and it increases catabolism. In the renal system, it increases GFR, it increases calcium excretion, which is a very important point, and it also increases urate excretion. Now, in the blood, it inhibits eosinophils and inhibits lymphocytes. Now, let us see the mechanism of action of prednisolone. There are these inflammatory mediators called as interleukin-1, TNF-alpha. They act on their receptor and stimulate nuclear factor kappa B cell. And then this NF-κB gets incorporated in the DNA inside the nucleus and expresses the gene for cytokine release. In the cytoplasm, there are this receptor known as glucocorticoid receptor, which are in association with heat shock protein 90. The prednisolone gets incorporated into this receptor. It dissociates from heat shock protein 90. Then it reaches the nucleus. Once this gets incorporated into DNA, it forms a dimer and causes gene transcription and produces mRNA. Then this mRNA gets translated and forms annexin A1. The function of this annexin A1 is to inhibit the synthesis of prostaglandin and other mediators. Also, this prednisolone inhibits the expression of interleukin-2. Interleukin-2 is important for immune response. And the third action of prednisolone is on NF-kappa B, that is, it inhibits its expression and hence inhibits cytokine production. Now, let us see the indications of prednisolone. It is used in many inflammatory and autoimmune conditions. In joint, it is used in rheumatoid arthritis and psoriatic arthritis. In GIT conditions, it is used in diseases like ulcerative colitis and Crohn's disease. In blood, it is used in cancers like acute leukemia and lymphoma. In neurological, it is used in multiple sclerosis. It is also used in atopic dermatitis. And in respiratory system, it is used in asthma and COPD. Now, important precautions which has to be taken care while using prednisolone or prescribing prednisolone. As we know, prednisolone decreases immunity and which leads to decrease in T cell activation and which leads to immunosuppression. But this immunosuppression can increase the risk of certain infections. Example, tuberculosis, varicella zoster and other fungal infections. So, possibility of these diseases has to be ruled out before prescribing prednisolone. Now, an important point, prednisolone can suppress the HPA axis, which leads to hyperglycemia, salt and water retention and Cushing syndrome. This salt and water retention can cause increase in blood pressure. Prednisolone can also increase the excretion of potassium and calcium via kidney. Hypocalcemia is a very important side effect of prednisolone. Prednisolone decreases calcium by two mechanisms. First, it decreases its absorption, another, it increases its excretion. Both of these leads to decrease in bone mineral density. Also, prednisolone decreases estrogen production, which also leads to decrease in bone mineral density, and this can lead to osteoporosis. And this should always be kept in mind before prescribing prednisolone in elderly age group. Other risks associated with prednisolone are it increases the risk of cataract and glaucoma, and also it can cause herpes simplex, as we already seen, and which can damage the optic nerve. Prednisolone can also cause GI perforation and also mood changes, example insomnia. Prednisolone is available in certain preparations like tablet, solution, syrup, injection and cream. The initial dose of prednisolone is 10 to 60 mg per day, and in multiple sclerosis it can be increased up to 200 mg. But as we have already seen, prednisolone can cause HPA axis suppression. It should never be withheld suddenly, and it should always be tapered down. So that is it for the video, guys. If you find these videos helpful, make sure you hit the subscribe button, and see you in the next video.